This is Priyanka Sarkar, and welcome to the Sport Soul, a space where we explore the real stories and emotions behind strength in sports and in life.
Hi, Dr. Christina. I'm thankful to have you here. I would like to ask you by starting to explain us when was it that you decided to become a doctor? Was it by choice or was it a decision that you took all of a sudden? Or how did you start your journey of wanting to become a doctor?
Hi, thank you for having me here. My journey started maybe during my childhood itself because we are a family of doctors. So I always aspired to be a doctor. And so it was already imprinted in my mind, and I did not have any backups as well. So it was always by choice. I have been a doctor.
Was this choice at any point in time a stress factor for you?
Stress factor, no, because the choice was mine and I loved taking that choice. So I did not have stress, but during the course of my MBBS, definitely we'll have that academic pressure, right? So that was somewhat stressful.
When you talk about academic pressure, that is what I want to attach with mental well-being. So were there kind of any stress factors in terms of balancing academic excellence and your mental well-being?
So there were points during the entire MBBS phase. There were highs and lows, and that was a part of our MBBS career. And how I had managed my mental well-being, I'm not sure, because those days it was not so vocal, and suicides were there, but they were basically people were not so vocal. Now, if you ask any younger generation doctor, they'll say that we are stressed, and they are always vocal about it. And if you ask, even in the class, if you ask them what is the if you are conducting any field study, what field study do you want to do, they always lean their opinions upon mental health. So somehow mental health as a concept has been enhanced during the past few years, also because of the rising trend of suicide among doctors. So those days we tried to somehow we never had this giveaway that we were not spared. So showing resilience was the main motive during our medical career days, because if you back out, that means you are weak.
Yeah.
So we always had to show up no matter what is happening in your life. So that is one thing which was.
Now, from being a medico yourself, you have become a faculty member for a next generation of medicos.
Yes.
Now, what is, apart from this difference of being vocal,
Yeah.
do you all, just being vocal doesn't mean that there are no issues, they're just
Yes.
opening up on it.
Yeah.
But the coping mechanisms, have they changed from your time to now?
I think coping mechanisms are individual based. Let us just say it in a broader way that everyone has their own way of coping up with things, and few people will have a pressure only in the academics. Few people will have in their family, in their relationships, because that is an age where you will be growing.
Yeah.
Those are your formative early 20s. Okay, and lot of decision making will be involved in most of the things. Your relationships, your family will be, everything is a toil over there. Maybe nowadays what is happening is, because of this, most of the young adults, so they move into this substance abuse. Okay, so or they go into depression and burnouts. Okay, burnouts are quite common. So even the first year, right now, if you ask me, even any young teenager also is facing
Yes.
burnout. Okay, so it is important for anyone to identify that they are in some kind of stress. So identifying that you are in a stressful state is the first step which anyone can take, and thereafter if it is too much and it's unbearable, it's always better to seek an expert opinion. Yeah.
I'll step back and ask you during your house surgeon months, year. Now, you have an academic pressure, which is different, which is like balancing academic excellence and personal well-being. But when you come into a house surgeon, it's now you're practicing.
Mm.
You're pretty much at the end of your studies, and you go about all your duties as a regular doctor who's just not registered. That's it. You're pretty much learned everything. Now there is stress. There is that rawness of raw exposure towards diseases, illnesses, and how does that affect you as a human being at a personal level?
Basically, a house surgeon is someone who is in the first level of clinical exposure. Okay, that is the point where they will be giving injections for the first time, they'll be giving IV lines for the first time, and they will be assisting major surgeries for the first time. And that is where also they take their decision which branch to go about with it in their post graduation. Okay, so at that level, what happens is usually decisions are tricky. Okay, decision making is very it is imposed with a personal as well as your pressure from your superiors. Okay,
Yes.
so it's always like that. Since you are the junior most cadre, you will have a lot of pressure from your superiors, seniors, and most of the times it should be like you have to fit in the box. You have to just fit in that particular box so that things will go easy for you. Okay, so that amount of such pressure does exist apart from the decision making thing. And also, since it is again a learning curve, they'll also face some subject level, they'll have some new exposure. So everything would be too new, and they are too naive. If you see in the the entire career, that is the first time they are getting exposed to many things at a single time. And also group tasks also will be there. So it is a mixed category where it falls into. And also nowadays when I see people are more inclined towards studies, so that they want to just crack the NEET PG. Okay, so they are more inclined towards studying rather than learning the clinical skills. That is what is happening nowadays.
So now I'll come back to you being a faculty member. Now, every faculty member in a medical college has completed MBBS, and they have done their masters as well. Do you see any kind of mental stress or burnout in your colleagues? Now, a clinically practicing medical professional is different. You are in the teaching faculty.
Yeah.
How is you seeing a student going through his or her own coping mechanism? Is it also seen in your colleagues in a way that they don't try to show it, but they just, is it seen amongst your colleagues as well?
Yeah. So as a medical graduate, as they evolve through their undergraduate and postgraduate and to their consultant level, what happens is most of the doctors face early burnout, and also once they reach the stage of consultation, they'll have a lot of impact, not only decision making but also patient wise decision making, and also clearly choosing the right method of application of their medicine skills. Also, they'll parallelly have their own family issues, or a family should be also considered over here. And apart from that, they'll have like the empathy would be reduced. Okay, de-empathization will be there. And also what happens is, since in high demanding situations where they continuously face lot of patients having deaths, or like a subject like oncology or something like that, so they'll day in and day out they face a lot of patients who are dying. So in those situations, sometimes they face even depersonalization. Okay, so that is happening. And there is a point where everyone should just pause and reflect upon themselves. Okay, and whether what is happening to them, is their decision making or empathy getting fogged by their own backlogs, in emotional way. Okay, because emotions again, they affect their clinical decision makings. Okay, so the medical graduate will gradually evolve and undergo all of these things. If they are not even clinicians, like people who are working on the college side, like only per academics or administration, even they face kind of burnout. So it is a blanket statement that everyone is facing some or the other kind of burnout, and it starts very early with anxiety and depression and so many things happening.
With students facing burnout, with they facing mental health issues, the staff is facing mental health issues. Do you think medical colleges should start, or should I ask, do they have anything in place where they teach mental health well-being as a part of their curriculum or anything as such, or do we have to start it yet?
No, we do have in our CBME curriculum where designated hours are like hours are designated, like around 40 hours in a year they are designated. One is in the clinical training in psychiatry department and clinical skills training. Apart from that, there are designated counselors who are involved, okay, who counsel the medical students. We are not, there might be loopholes where the counselors will be present on paper and they are not present in person, but there are activities which are happening which address the mental health of the individual. Also, since they have upgraded the curriculum, we have a module called EdCom, like attitude, ethics and communication, which will enhance the students' ability to pick such conditions, okay, like depression, anxiety, or make them more vocal, having their communication skills. So many things are happening. Also, if I am not wrong, ragging also is more prevalent in medical colleges. Okay, so they are also trying to, as the students come in the first within the first 1 month after they are joining, they have a designated day where they'll be addressed by their state DGP or the police commissioner, where they will be addressing the anti-ragging squad. Like there is a anti-ragging committee which is being formed, and they will address the entire first year students who join. So yeah, medical colleges do have this in their curriculum.
So, in a educational institution like this, a medical college, clinical skills are prioritized. That has been the old age tradition. Now, slowly, is it right to say that slowly that psychological skills are also being prioritized, if not at the same length? We have started prioritizing them.
Yes, for example, suppose they have to break a bad news to the patient, they do teach how to take break that bad news. But it comes in the ethics and communication. Since we have to target a medical student in a wholesome way, like, because not only their clinical skills, even their communication is very important. So there is a lot of violence raising against doctor. If you see any newspaper or any social media, you see every other day a doctor is brutally beaten. Okay, it's not only it's not completely upon the patient. Sometimes the doctor might be at fault, where they don't communicate the prognosis of the patient to the attender. So the doctor should always have this skill that they have to convince the patient's relatives and the patient and be very clear about the entire procedure. Also, it's always thought that it's not when you say clinical skills, it's always bedside. Most of it is bedside.
Yes.
So even when you're examining the patient, how do you take the consent of the patient, whether the patient is willing for a certain test or not? So all these things, all these factors do come into existence. So yes, the student is always trained in a holistic way, but it somewhere the system fails. At some level the system fails, so such mishaps are happening.
Now you say that we are training students or medicos to be empathetic towards the patients. However, at any point in time, you also did mention burnout, stress, and they might not open up about it. I was talking to a friend of mine who has been my friend for 17 years. And then he said, I never tell about my mental health struggles to anybody. So many students do not open up. How do you identify signs of burnout or stress in a student in a class of 100 or 75? How do you identify that student and say, okay, Now you don't need to speak up, but I can see that. Come, let me help you.
Yeah.
How does any medico or any faculty member, for that matter, identify the signs of burnout or stress in students?
Yes. So let us just think over what are the signs of burnout. You show signs of apathy, don't want to do anything, or you feel like not going to the college. And maybe there might be chronic absentees or alternate day absent. Okay, and there will be slowly declining your health. Okay, so they might be falling frequently ill. Okay, for small tasks also they might be worried too much. Okay, so all of these things are kind of signs of burnout, and most of them are, and maybe they'll have signs of overeating, undereating, some undernutrition might also be present. So those are the few very broad signs of burnout. Now, how do you identify this? In a class of 200 to 50 students, the teacher will focus on delivering the lecture and not upon whether the student is present or absent or what is happening. Or maximum what they observe is whether the student is attentive or not.
Yes.
Correct. So instead, what they have done is they have come up with something called as mentorship program. So each of the faculty will be given few of your students where you have to follow up that student right from the beginning till the end. So during the mentorship meetings, when the student comes, so you will have a more detailed understanding of the students. So it is the duty of every professor that they identify any ill health or any concerns about the students, because once you talk to them, you talk to them in a non-formal way, not only formal, because making yourself formal will restrict the student again. You go a bit light on the student and then try to understand their own perspectives. What do they do in their free time? Do they have any giveaway? Because maybe some hobbies they can inculcate. Okay, and whether they are performing better. Okay, they will always have a performance charter, right, where they will be performing in formative assessment or the assessment classes, and their attendance will be taken into consideration. By looking into that itself, you will understand whether the student is able to student is in a normal state, or they are quite stressed out, or is it are they in a place where we have to intervene? Okay, so those are the programs which will be conducted.
So was this system there when you were studying medicine?
It was there. It is always there. It was always there. It's just that most of the times might be they are on the paper and they are not followed. Okay, so these are the loopholes which are happening.
So it's just that there is a safe environment always, which has been created at least on paper. And when I know that I have a mentor whom I can go and talk to, that there is a system, it also falls on me, who is vulnerable at this point in time, to go and take the first step. Is that correct?
Yes. Actually, when you say mentor, if you ask me who was my mentor, I will say my senior was my mentor. Okay, nowadays what is happening because of this rising ragging trends and so many things, posh acts also have come into existence. Because of all these things, I feel there is less communication between the senior and the fresher batch who is joining. So usually during a decade ago, and even our parents had this. It was like a custom that a fresher joins, and there would be some amount of ragging through just it was an ice breaking session.
Yes.
And so that they get more close to each other, and then since day one till the end, they will be guiding them. Okay, they will be guiding them in their academics, in their personal life, in their decision making, and a few people are so good that they become like a family friend for lifelong.
Yes.
Okay,
Yes.
so that is the type of relationship we had, and we never had to go to our professors or higher authorities to seek for mentorship. Because of all these things happening, now the students is always bent upon either only their peers or their mentors. Okay, that is what is happening. So in this case, what happens is you have to always identify your circle. Okay, who are very close to you. Okay, first would be your a family, your siblings, your extended cousins or whoever, and then your friends, your friends in the class, okay, and then your seniors, and then people, other counselors, other mentors, other doctors, someone whom they look up to. Inspirational figures, okay, all these things. So you identify your core, and then you reach out to the nearest person first, okay, and you reach out to when your emotions are very when you have very private emotions, you always reach out to your immediate circle.
Yes.
Okay, you never go and tell all your private things to the some external circle. Okay, so you always identify your circle and then communicate with them freely.
So that brings me to a different set of questions. I'll shift a gear a little. So most medicos, they start their journey, medical student journey, as teenagers. They finish their 10th by 15 years. They write, if they crack it at first, 17 or 18, they are teenagers. Before they can start off the medical academics journey, they are still teenagers. So what are the kind of mental health issues that a teenager would face?
Yeah, so as a teenager, they step into this something called as a big professional career, and which will go on for 5 more years. And as soon as they step in, there is always a pressure from various angles that this course is difficult or you will not be able to do. There is a lot of negative talking running around. Okay, and also I have seen that there is a common notion saying that people who are from non-medical background, they can't survive medical college. It's not true. Once they attend there, for example, we stepped into our medical college, and within 2 weeks or something, we had a small test. Okay, small viva was there. Viva was very new for us because we never had viva before that. And we were only 17 or 18, as you said. And that viva thing was of physiology viva. And it's not like people did not read for it. There were different sets of groups, how they faced the viva. I'll just explain it to you. There was one set who used to read day in and day out, and they were confident that they would pass that viva, because that viva differentiated us into slow and fast learners, just like that. So that that particular professor thought that it's better to expose them to some form of test this thing, so that they will be used to it. Now what happened, there was another group which took it too seriously, that they were not able to cope up for that very small viva, which is only for 5 or 10 minutes, and hardly they had questioned anything. Okay, so they started crying, they started blacking out, they started going home, or they started complaining, and all those things. That was the set, few people. There was another set where they just gave up, and they did not want to study anything. They just gave up, and they were actually smart. They were smart. It's not like they don't read, but they just gave up in the beginning itself. So there was everyone had perceived it in a different way. And but the test was bare minimal. It was very minimal, just like a baseline test. So it depends on how you are perceiving it. At the end of the day, every individual is from different background. Okay, and everyone's thinking capacity and all the capacities are different. Emotional, intelligence, everything is different. So the way they perceive is different.
Now, Andhra Pradesh has mental health counselors for schools.
Those counseling sessions or counselors, they are not only in schools. Now, NIMHANS has opened up, it's a national-wide online toll-free number, which it is called as Telemanas. Telemanas is 24/7. It has counselors in it. So what if you are having any difficulty, or if you are facing any part of difficulty today, if you are facing that, okay, my spouse is not treating me well, and if she feels suicidal, or she has to talk to someone and no one is there, and she can then directly call up and talk to the counselors. Okay, So that is what is happening. Not only counselors, not only counseling sessions, but this is a toll-free number, and your detail, your identity will not be hampered. Okay, this is a national wide which is opened up national wide.
So we spoke about schools, we spoke about medical institutions, we spoke about medical colleges, and we also spoke about hospital workplace settings. I'll come to a place where everything starts with family, with the community. Now, what I might not see, my neighbor or a community member can see.
Yeah.
And you also told me that not everybody has a psychiatrist within their vicinity. And when I was talking to you, you said every 1 day a week in a PHC has been allocated for psychiatric screening. Can you just talk about that?
In our primary health centers, we have designated days for each of the national programs, if you say, like 1 day only for your hypertension, diabetes, your NCD screening, and your cervical cancer screening, and so on. In that, nowadays there is a designated day for mental health camps. So during that day, the psychiatrist would be available, and people who you require any treatment or they want to do any follow-up, they can come and visit the center and give get them counsel. Also, there is existing stigma, and which I don't know when will it go away, but there is stigma. But at the same time, there is also some form of open up within the population, because people are hearing so much. Your digital media is rampant talking about mental health. So at some level they are seeking mental health, but also we have to see that they are not going to some or the other quacks, because everyone is speaking about medicine, mental health and nutrition and so on and so forth. So it's always better you seek a psychiatrist. For example, if there is a stigma, the person is hearing noises, of a person is seeing a new, seeing new objects or something different from the usual. Actually, they might be having schizophrenia or hallucination, delusion, something. So it's better you consult a medical practitioner and then a psychiatrist, at least a medical practitioner who will at least do your provisional diagnosis and refer you to a psychiatrist. And then if you are, depending upon where you are, where you stand, you can be taking help of a psychologist, counseling sessions or a therapy sessions. Okay, so it's always better that we go. In Western culture, people go for therapy sessions.
Yes.
Okay, it is open. It is openly they go. Even marriage counseling exists in
the
Western.
So that brings me to two parts of awareness, two areas of awareness, which is very important. Now, you said if a person is listening to noises or seeing things that you cannot see, it is categorized as black magic or supernatural by two forces here. One is the community and the other is family.
Yeah.
Now, families and communities are interrelated and interdependent. You cannot just live as a family on your own without the community's help, and vice versa. The community cannot live without each of the family within them. Now, when these two come together and say, oh no, it's black magic or it's supernatural or it's something else, one supports the other, and unfortunately, because it is intertwined at a point somewhere, they do not have different, they just form a strong voice because they're coming from the same perspective. Now, I want to ask you, how can we create awareness in communities and in families about these kind of things, that it is not supernatural, it is a mental health condition. And when you educate one family, it is not enough. You have to educate communities as such.
Yes.
And you cannot go door to, I know you go to, you as a campaigner, you go door to door, you conduct workshops, you conduct webinars, you do whatnot. And now everybody is doing it at their capacities, but there's too much of information around. They are quacks, they are unqualified professionals doing everything. Now, in such case, it is very easy to be lost when you have too much of information. So, but coming from an authoritative or authentic voice like yours, I would ask you one question, and I would like to you to help us understand, how do we create awareness amongst families and amongst communities? Because sometimes I came across certain instances where, an anchor would be talking, and in the comments the people would be saying, your throat, there is a lump in your throat, go and get yourself diagnosed. There have been instances when the comment, the people went and read the comments, they went, got themselves checked, and they were diagnosed with certain levels of cancer. There has been this news in the Western media. So we play an important role, somebody as observers. So as a community, we observe, as families, we observe. How do we create awareness on mental health issues, saying this is not that, this is something deeper, and this is the meaningful way of doing it? How do you do that?
See, so I'll just step back and tell you that when a child is growing, it starts right from the day you're born, okay, or you're in your womb, okay, because that is where within 20 weeks that your child will be able to hear, and all those things will be happening. So all these things at some level or the other is impacting the way your brain is shaped, okay, emotionally, right? And also your genetics play also into account, because certain diseases, they are genetically inherited, okay, like schizophrenia and all, they are genetically also inherited. Keeping all those things aside, let us talk about a normal human being who is a child right now, and his development starts right from the childhood. Now how your child performs, how your child works, or what is his capacity, okay, where he is getting triggered or what is happening to him. So it's always important to observe right from the beginning, okay, so that we can pick up early signs like ADHD, okay, there will be speech difficulties or difficulty in few other decision making, or the child is throwing tantrums, okay. You observe it, and you have to always consult, go on with periodically, you have to consult your pediatrician, so that by the time they reach adolescence also, what happens is you will have a track of your child, where your child stands or what is happening to your child. First you should be aware, only then you can educate that child how better they can understand their emotions. Are they able to cope up with stress and other decision making skills, and are they able to perform in general, okay, in not exceedingly well, but at least in a neutral way. They have to be neutral about their emotions. Having said that, once they identify, now that is their core circle. Now once this is done, then you step into your community level. At the community level, they might identify. Now once this is done, because it should not be like a child is not able to speak to their own parents, their own father, they can't tell their emotions, and then they go to seeking. Your family should is responsible for their upbringing. After that, community comes. Not directly family and community doesn't hold good. First family and then community. Community, it depends on where you are staying. And nowadays, if you don't know how to, whom to ask or what is an authentic source, you can always go through standard articles which will give you a proper information. Okay, not the YouTube material or something. Standard articles which will give you a proper input over where the person stands, and better consult a medical professional.
That's quite insightful, and I would like to wrap up with one important question. We have spoken about awareness. We have spoken about how to identify. We have spoken about whom to go to. But it's always about opening up and having that conversation where family plays an important role. నాకు ఇప్పుడు మనసు బాగాలేదు అంటే ఏం తింటావు, బిర్యానీ తినేసి పడుకో, లేకపోతే మ్యూజిక్ వినేసి పడుకో, లేకపోతే వెళ్ళి అది చేసేసుకో. బట్ నో బడీ ఆస్క్స్ ఇఫ్ దిస్ ఇస్ రియలీ అ మెంటల్ హెల్త్ కండిషన్ ఆర్ ఇట్స్ అబౌట్ మెంటల్ వెల్ బీయింగ్. సో how do we as families open up conversations about mental well-being and mental health?
As families, usually they say you can open up during your, you better sit together and eat, and during that time they can have a conversation. Also, they in few families, kids are more attached to one parent or the other. So these parents, they can, just take, like they can. Ask little bit leading questions, especially during their growing ages, whether what is happening. They might be having some a breakup or something, or they will not be discussing it with the parent. So it's always better that they open up freely about so many aspects going on in their life, not only just their studies, what about their friendship circles, okay, and what content they do, which factor in their lives is playing a crucial role at that point of time. Okay, so all these things can be taken into consideration. Also, during early adulthood, your hormonal changes would also play a role. Okay, for a woman, especially for women, it's like your progesterone, estrogen levels are going haywire, and you might be having some premenstrual syndromes. It's always better you acknowledge your symptoms and then work your diet accordingly. You can do your lifestyle modifications accordingly. So individual level, it's always that everyone, for everyone it is the same. It's like what time are you getting up till what time you are going to bed, how you're dividing your time, how are you taking care of your health between your work and studies, and whatever your work life study balance, if you say, between all these things, how are you managing your mental health individually? Okay, individually. So are you taking enough, are you giving your body enough exercise, your nutrition? All these things do play a factor. And also you should have some hobby for yourself, okay, and you have to have some social circle, and where you can socialize at least in a weekly once at least, if not more, but somehow. Okay, so all these things you have to set it, and you have to work for it. It's not like everything will fall into place.
Yes,
okay,
yes.
you have to work intensely and ritually
And intentionally.
intentionally.
Yeah.
Okay, for at least they say at least for 90 days, if you do, it will become your habit,
Yeah,
right?
habit, yes.
So at least you, if not a habit, at least on and off, at least you should be aware that you are working towards your mental, because nothing is going to come directly to you.
True, very
okay,
true.
so you have to, if you are feeling depressed, or if you know that this is hurting me, or this is my trigger point, you have to work for how to avoid it. Okay, what are your trigger points, how to avoid it, how better you can manage that situation, okay, emotionally. So that is very important.
That's very insightful of you to say that, because as a society or somebody who is going through this mental health issues, it's easy for us to pinpoint community. It's
Yes.
easy for us to pinpoint the workplace or the family, when the work has to be within ourselves. So that is what I'm going to take away from here. And thank you so much for gracing this episode. And it's been wonderful having you here. And if you did not know, she's my sister-in-law. Thank you so much. Bye.
Bye.